think we should also talk, though, about the side effects with the entire class,
Right.
which is important for everyone to know. I mean, many patients are quite surprised that they get constipated right around chemotherapy when the expectation is that's not going to happen. So I make sure to educate my patients about constipation and headache with the 5-HT3 receptor antagonists. And I'm frequently shocked that many of my colleagues are unaware of those side effects. So how do you guys engage your patients in that?
Yeah, I think that's a great question.
So, I mean, I think a lot of that falls onto the nurses too. So definitely during that initial consultation when chemotherapy is discussed, there's a significant talk about symptom management and the side effects. And not only the side effects of the chemotherapy drugs, but the supportive care agents as well, and what to do to alleviate those so that patients aren't surprised when they do experience them. The other thing is when patients come back for treatments, we sort of reiterate those side effects over and over again so that it's really drilled to bring it back home that, you know, once again, you may have forgotten that we did discuss this last time, but just to remind you, this is what may happen again.
Along that line, I mean, it's one thing to tell them this might happen, and I know you guys do more than that, but let me pull you out a little bit more for this, so that if you get a headache, you should take some Tylenol.
Right,
Okay,
definitely.
So, but that's kind of the answer that usually cover. This is a Tylenol type headache. This
Yeah.
is not a morphine type headache.
Right.
Yeah, absolutely.
And if you get some constipation, take a dose of Senna or some Miralax, something like that. Correct? Or do you do something different?
So absolutely, those are the recommendations I make. And I think to Rebecca's point, people are just so inundated with information on the first cycle that they don't always hear these things. And then, of course, when those symptoms happen, they become a lot more relevant and remember things that are relevant. So this is actually a good thing to continue to review and give them the tools, as Charles has really pointed out, on how to manage them.
Well, and patients also get written information too about the different regimens and what medicines they're receiving, and written information about what to do in case.
I think it's important to tell the patients to communicate. I've had so many patients who come in and said, I had a splitting headache for 3 or 4 days, but I didn't take anything. Because they don't know that it's okay to take Tylenol. And even though we've said it to them, you know, the memories are tough. So let's just tell our audience, though, what the percentages we would expect. I think for headache, it's about 8 to 10%, and somewhat less for the GI side effects, which also can include diarrhea as well. So it can be constipation or diarrhea. Those are the major ones, I think.
Yeah, I think those are the numbers that are supported in our studies, but when I talk to nurses, they always shake their head and say their experience is much higher. So I don't know if it's just a reflection of clinical trials in general, but that seems to be really common.
So one question I want to ask you all is, what do you do for the patient who has the headache with the first cycle of therapy? Do you change to a different drug in the same class, or do you just work them through it with symptomatic treatment?
So I wouldn't think to change unless it was a really, really big problem and the nurses told me we needed to change, because I always listen to nurses because that's wise. And I have
We've
7
all
sisters.
learned
I've
that.
got 7 sisters, and I learned early on, and not all nurses are women, but so it doesn't. And maybe I'm unaware of this, but I think the nurses here are doing pretty well. But I don't get patients come back complaining much of headache in my clinic, and that might be the process that's getting treated. And occasionally I hear it from some that take Tylenol, but it doesn't seem to be a big problem. I've never changed antiemetics because of either headache or constipation. Take a little Senna.
Interesting.
So I think the other thing we have to look at is what else is going on with that patient too. What other medicines are they taking? What else could be causing the headache or constipation as well?
And not to mention, they're getting very toxic chemotherapy
And
as part
multiple drugs
Right.
in addition to the
And
medicines
anxiety.
we're taking,
And
we're
anxiety.
giving them.
And from a pharmacy perspective, not even just prescription drugs, also too, what herbals and
Over the
point.
counter, yes.
things at GNC they're buying. You know, and there's becoming a lot of information now about the drug interactions that are with those herbal medications. So it's also something that, at least in our own practice, you know, we ask about frequently as well to make sure that there's no problems from a drug interaction standpoint.
Yeah, and I think personally, I probably under-ask my patients about the use of other medications, herbal or other complementary medications. And we know from recent surveys that over half the patients in our practices are actually using these. That's a great segue.